All right, let's get real about breastfeeding. It's a journey filled with so much information, and unfortunately, a lot of misinformation too. If you're a new parent or even expecting, you've probably already heard all sorts of myths. Some flat out confusing, leaving you scratching your head and wondering what's true. Or even a little scary, making you question your abilities and the choices you're making. But don't worry, I'm here to bust through the noise, clear up the confusion, and empower you with accurate information. I'm going to give you the real facts, backed by science and research, so you can feel confident in your decisions. Myth number 1. Breastfeeding comes naturally to everyone. It's often portrayed as this effortless, intuitive act. Fact: nope. Both you and your baby are learning something brand new, a complex dance of instincts and coordination. And it can take time, patience, and practice to get the hang of it. It's a learning curve for both of you. Most moms need a little help, and that's perfectly okay. Whether that's from a lactation consultant who can offer expert guidance, or just a good friend who's been there and understands the challenges. The key is patience and not beating yourself up if it doesn't click right away. Be kind to yourself and your baby as you navigate this new experience together. Myth number 2. If you don't produce milk in the first day, you can't breastfeed. This can cause a lot of anxiety for new mothers right after birth. Here's the truth. Your body actually starts with colostrum, which is super concentrated, liquid gold, and packed with antibodies and nutrients perfectly designed for your newborn. The full milk supply usually comes in a few days later, typically between day 3 and 5. So don't stress if things seem slow at first. Your baby is getting exactly what they need from that colostrum, and your milk will come in due time. Myth number 3. You have to eat a perfect diet filled with only organic and nutrient-rich foods, or your milk won't be good enough for your baby. Science says your body prioritizes making nutritious milk for your baby, drawing on your own reserves if needed. Even if your own diet isn't flawless, and let's be honest, who eats perfectly all the time? Of course, eating well is great for your health and energy levels, which are especially important as a new mom. But your milk is pretty amazing no matter what, providing essential nutrients and antibodies to help your baby thrive. Myth number 4. Small breasts mean less milk. This is a common concern for women with smaller breasts. Nope, not true at all. Breast size doesn't determine how much milk you make. It's all about the milk-producing tissue inside. Milk production is all about demand and supply. The more your baby nurses, or the more you pump, the more your body makes to meet that demand. Myth number 5. You can't breastfeed if you're sick or on medication. This can be a real worry when you're not feeling your best. Actually, many common illnesses and medications are perfectly safe during breastfeeding, and in some cases, breastfeeding can even pass on antibodies to your baby to help protect them. But always double-check with your doctor or a pharmacist just to be sure about the specific medication or illness. And hey, here's a bonus myth, because we can't resist tackling one more. Formula is failure. Absolutely not. Every family's feeding journey is different, and there are so many valid reasons why a family might choose formula or a combination of breastfeeding and formula. And what matters most, above all else, is that your baby is loved, fed, and healthy, regardless of how they're fed. So next time you hear one of these myths floating around, or any other breastfeeding rule that doesn't sit right with you, take a breath and remember the real science, and trust your own instincts as a parent. You're doing an incredible job navigating the challenges of parenthood and making the best choices for your family. And remember, there's no one right way to feed your baby. The best way is the one that works for you and your family. If you found this helpful and feel more informed and empowered, share it with a new parent who might need a little reassurance today, or anyone who could benefit from debunking these common breastfeeding myths. You've got this. You're stronger and more capable than you think.